are you?
Very well.
Yes.
How are you? Hi, very good. How are you?
Ultrasound diagnostic, and it might have to travel to the higher level facilities.
It's a new innovation program, and it is paid.
What really the patient has. With focus available locally,
we must work together to reduce the high and unacceptable number of women who die from pregnancy and childbirth complications, which places Kenya fourth among African countries with the highest maternal mortality burden. Now that we have the guidelines, I urge the Ministry of Health to expedite their launch and implementation to ensure that our women reap the benefits of this initiative.
Access to essential care like ultrasound is crucial but often limited. There is limited equipment, trained staff, and costs are again a major barrier. We at the ministry recognize this challenge. The point-of-care ultrasound offers a powerful solution. Point-of-care ultrasound allows for early intervention and timely referral, improving both maternal and fetal outcomes.
Based on what you used to have previously called Linda Mama, the package has been enhanced to ensure that mothers and children can be able to access the best healthcare services. Our maternal mortality ratio stands at 355 per 100,000 live births. However, out of 10 women delivering in Kenya, 9 actually deliver in a health facility. It is with that, therefore, that we should be able to have a lower maternal mortality ratio than we actually have currently. It is through such innovations as these guidelines that we are going to release today that we can be able to impact the health of mothers and children, especially in the rural underserved communities.
Karibuni sana. And now